Hi folks, you're with Tacitus today at your Pushback channel, and thank you for joining this radio live stream. In this essay, I'd like to talk about sort of Medicare or medical benefits fraud generally, and this could be across the entire Western world. And there's a recent report that's come out in Australia that I'll use that as sort of the springboard for this story. But this story or essay is about Medicare fraud. Or alleged fraud, I should say, and rorting the system. Now, the allegation in Australia is, if I've understood the report correctly, is that around 25% of the Medicare payments that are the taxpayer funds, 25% of the Medicare payments are fraudulent or some way rorts and corrupt in some form out of things. So 25%. So we're talking somewhere between $8 and $10 billion dollars, as I understand it, at least. So now there are sundry things along with the Medicare system, such as subsidising pharmaceuticals and things like that. So I just want to do a sort of deep dive into that. Now, ever since Medicare began, there have been allegations of improper use of funds, rorts, frauds, and so on. Now, this can be fraudulent in the sense of allegations that doctors are filling out rebate forms, where the government. So, say someone comes in to see a doctor, the government says, we'll pay you. Actually, I don't know what the rate is off the top of my head, but we'll pay you $50 for for example, every patient you see. I think it's more than that, but for example, $50. So the doctor then fills out a form saying that they saw, they had a medical consultation with Billy Bob, and they send that form in, and the government, within 30 days, as I understand it, then reimburses that doctor or that medical practice or whatever the case may be. So, the allegation is that the doctors are filling out phantom forms or saying that they saw more people than actually did, or inventing people, or dead people are filing claims, all those sorts of things. Now, and various other, alleged fraudulent activity around filing false claims to get bigger payments from the government purse. Now, if I go back in time and look at the claims of fraud, that it was 5% or it was 10%, but since mass immigration has begun from third world countries that had very low quality healthcare systems, and where in most cases people have to pay for it themselves, places like India, and particularly places like India, but also places like China and so on, then or the Philippines, or whatever the case may be, poorer countries, then there's been a mass influx of people who want to use the medical care system here, not only for themselves but also for their relatives back in India or China. So since the mass immigration has started, then the proportional increase in fraud and corruption in the Medicare system has increased in line with the mass immigration. So, and a lot of it, I think, is being undetected. But I've spoken to, or known, I've known personally doctors and say, particularly general practitioners in a medical practice, and some of them have retired now, and they sort of just talk about the rorts and say how incredibly widespread they are amongst the immigrant communities. For example, say an Indian or a Chinese person gets a citizenship, and they get their Medicare card, which means they can go to doctors that are signed up for what's called bulk billing. That is, you go in, you don't have to pay anything. So you just hand over your card and you don't have to pay anything to see the doctor. Other doctors have like a co-payment of $25, $30, $40, $50. But in the bulk billing ones, as they call them, bulk billing, you can go and get a medical consultation. It doesn't cost you a penny. They just run a copy of your Medicare card and you're done. So Now, in those cases or situations where one sort of Indian or Chinese person gets that card, they will then be in a group, because they live in these community groups. So they will then give their card to or rent their card out. They may give it to family members, but they'll rent their card out to anyone in their diaspora. So 100 Chinese people may use this one guy's Medicare card, so they can all get free consultations with the doctor. So now they just say, yeah, my name's Ching Chong Chat or something, and then they're in there, and so all these people and this is a 25-year-old Chinese guy. So how do you know he's not the one? Can you show me your some other ID? Oh, I left my passport. Or they'll even take the passport, and if they hopefully look similar. But look, the rorting in that sense is absolutely monumental, and I've heard this from a number of sources. So they'll rent their card out for say $25 a go, and of course that these people that are living in Australia or in Australia temporarily, say student visas or whatever, they may have to pay $200 for a medical consultation, but now they're getting it for $25 by using this guy's card. So there are huge rorts along those lines. But for some reason, the GPs I've spoken to, the general practitioners at the medical practice, they say they report these things, but for some reason the government doesn't want to touch it. But there's a clear relationship, in my view at least, between the mass migration, people coming from corrupt third world countries, where gaming the system and bribing and all these sorts of things are just how life is in these places. India, for example, is a corrupt backsheesh, as they call it, a corrupt basket case. So when people, the Indians come here to Australia, they don't see any problem with behaving that way. It's how it is in India, and if you question it, you're a damn fascist, Nazi, racist. So this sort of rorting is particularly widespread. Now, also in pharmaceutical benefits. I mean, I've been in, I went to get some pharmaceuticals in an area where it's there's hardly any white people live, and this particular area is all sort of Chinese, and in the pharmacies, you'll see a person will turn up with a pharmaceutical benefits card, or like the Medicare card thing, and they will load up multiple shopping trolleys, this is grocery shopping trolleys. So they'll load up multiple shopping trolleys. They got their flunkies in tow, and they're loaded up with all these like prescription pharmaceuticals. It's not off the shelf pharmaceuticals. This is prescription pharmaceuticals, and they'll go wheeling it out the pharmacy, and no one seems to think twice about this or investigate it. I mean, you've got to be kidding. I mean, seriously. Now the scam here is then that's not for their own personal consumption, obviously. So they're sending it overseas back to China or wherever whatever third world country they came from, for their relatives, because either their relatives can't get those pharmaceuticals in their third world country, or they can't afford them, or both. And so they acquire these things in Australia under taxpayer subsidised circumstances, and then send it off back to the third world place that their relatives live in. And, that's a massive scam. But again, no one seems willing to touch it. Goodness me, I don't know why. There have been some sort of attempts, in an area where there's, the Indians sort of do a lot of it. Particularly the Indians are very bad at this, and in my opinion, and they have some clampdowns on this, where the Indians aren't allowed to. Or they'll go to certain pharmacies and say, look, the government will investigate us, and they'll say, look, don't let people buy bulk pharmaceuticals. They can only buy enough for their immediate personal consumption. And so, they'll do that clamp down. But what they do is they get snotty about it, especially the Indian pharmacists, because they just see this as racist. It's anything the white people do to question or limit their arbitrary behaviour. It's racism, it's fascism, it's Nazi, it's Hitler. And so they'll clamp down particularly hard on white people. So if a white person's going on vacation and they want an extra month of their personal medication, the Indian farmers say, no, you can't have it. If the government wants to be tough on us, then we're going to be double tough on the white people. So they have this snotty, spiteful schoolchild attitude that they do. But coming back to the rorts thing, as I've mentioned in other videos, I look after or help an elderly relative who's somewhat infirm and can't do the running around and gets all confused and bothered with the paperwork and doesn't know where to start and that sort of thing. So I help out, and it takes quite a bit of time. But she had an ailment a while ago and needed to get that investigated. But here's where I think the big rorts are, and I've got a front row seat, personal experience at this. And I think the big rort is over-servicing when they don't need to. So someone, my relative in this case, but someone goes in to see the doctor and says, well, I've got these symptoms. Doctor says, look, I don't know what's wrong with you. They do things like blood tests and whatnot. No, still don't know. I know there's a problem, that I get, but I don't know what the problem is or indeed what's causing it. So I don't know what medication to prescribe. Do you need an operation or something like that? So the doctor says, this is the general practitioner, says, I don't know. So what I'm going to do is I'm going to refer you, the patient, to multiple specialists. Now we'll go through these specialists one at a time, and in maybe no special order, and then those specialists will advise on what they think's wrong. So here's 5 specialists I'm going to refer you to, but I can only do that one at a time, and so they refer you to the first specialist. Now, because I have to do the calling around, again, I've got the front row seat here. So you've got to call up to make an appointment. Now the specialist is booked 3 months in advance. So you've got a 3-month waiting list before you can see the specialist. So now my relative's in a bit of pain and discomfort. So I go back to the general practice, because the referral is specific to that specialist. So you have to go back to the general practitioner. Again, that's another, more driving, more phone calls, more time, more sitting with her at the, in the doctor's surgery, and then you have to go and see the doctor. So look, that doctor's on a 3-month waiting list, and either can you refer us to a specialist that we can see in a shorter space of time, or can you pick another specialist that we can see in the meantime from your list of 5, as in the 5 different medical categories that the doctor wants to refer us to. And he doesn't want to refer us to a different specialist. Now, that to me straight away is a bit suspect. Why not? Getting the patient quick, efficient service is the issue here, not whether the specialist is one of your fucking buddies or you've got some back scratching deal with them. Maybe it's personal. Maybe you play golf every weekend with the guy. It doesn't matter. But that the objective isn't for you to protect that little cozy relationship. I didn't say this, by the way. I don't want to piss the guy off. But it isn't to protect that cozy relationship with that specialist. So clearly there's some sort of relationship now. It could be financial, it could be personal. I don't know. But the doctor's very determined to hang on to that referral. Won't refer us to a different specialist that we could see, within a few days or a week or something. So, all right, then we'll leave that there. You're not going to refer us to another specialist. Probably could have insisted on it and jumped up and down, but I thought, no, all right, you want us to go with that specialist. Nonetheless, it's a 3-month waiting list. So we need to look at another, let's get another specialist out the way and get that investigated. Some reluctance here, but a bit of pushing and shoving. The guy finally agrees. So we then get referred to another specialist. That's still a 2-week waiting list. So we now again, I'm on the phone calling up. Also, things like a lot of these specialists have some form of co-payment, and they're very vague about this on the phone. So when you're trying to nail it down and say, well, do we have to pay an extra $100 or $50, $1 million? What is it? That they're very vague on that over the phone. And the quality of the staff on the front desk of some of these medical practices is absolutely woeful, by the way. So I'm on the phone. I make the arrangements. Then I've got to drive her there and sit with her and so on and then inevitably it's late and so she gets looked at. Then the specialist says, well, I don't know what's wrong with you. I mean, you're the fucking specialist, for Christ's sake. I don't know what's wrong. But what I'm going to do is I'm going to send you out to these 5 tests. So now, okay, so there's a battery of tests that's yet more calls, more traveling, more time, more sitting around. It's a big investment in time and energy and effort and cost and so on. So then going to and you arrive for the test and they say, oh, by the way, Medicare only covers X amount and you have to pay another $200. And so, well, no, hold on a minute. This is clear. This test is clearly covered under the Medicare Act, under the Medicare rebate scheme or the Medicare payment scheme. So no, this doesn't require anything. And she's on a pension and things like that. So then you've got to squabble and argue and there a lot of these places the staff are paid a commission on any bucks they can wrangle out of you. So there's a lot of bluff but you can't have the service then. We're not going to do the test. So you almost have to threaten, well, let's discuss it in front of a magistrate or a judge. Is that what you want? It can take quite a lot of toing and froing to get that sorted out. And even if you've got it sorted out on the phone that there is no co-payment or additional payment, then you arrive and you're speaking to Sue Ellen but the lady that said you don't need to make a co-payment is Billie Jean, and that's her day off, and you get all those sorts of things as well. So but every time you have one of these tests done, you then have to go back to the specialist. Whether the specialist has got anything to report or not is irrelevant. So another phone call, another appointment, another 2 weeks of waiting, and then you return to the specialist who wants another $200 to say, no, there's nothing in that report. I'll now refer you to the next report or the next testing. And then it goes back and go forth and back. And every time you have to go back and get nothing in return, you have to pay another $200. Again, apart from the fact of the waiting and the time and the phone call. And they see that as how things are. And some of the specialists, by the way, who are very bright, I mean, I don't doubt that, but some of them seem to think, because I made some complaints that this toing and froing about it costs an awful lot of money, but achieves absolutely nothing. And the response I got was, well, if your relative wants to be in the presence of my brilliance, then that's just damn well how the game's played. And okay, sure, right. So anyway, this is over. So all these tests that are being sent out to, I don't know if any of them are really needed or which ones are needed. Some of them seem quite obscure. I mean, why would you need to go that? That would seem, certainly with the engineering mentality, I have a look at, well, that test would be the least likely to produce or to investigate on balance of probability the most likely cause. Now, I'm not a doctor, so I sort of hesitate to, but just looking at the sheer logic of it, that test doesn't appear to have any relevant application to the immediate. If you want to do that test at the end, but there's some tests we can do at the beginning which are far more likely to do it. But instead, you're starting with the tests that appear to be the most obscure, almost as if you're just stacking the deck and we're eliminating a possibility. It may be remote, but at least we're eliminating it. But sure, with all that time and expense, so I don't know whether these specialists are getting kickbacks or whether it's part of a scheme to demonstrate, how big time they are, because they're referring so many people, so they must be big players in the game. I don't know, but there doesn't appear to be any sense. So I see now, if you multiply that by 5 other specialists all sending you out to multiple tests, then you can see the cost. The cost is enormous. The cost in time, the cost in driving around, the cost in petroleum, the cost in fees, of course, and so we're talking many thousands of dollars here, just to be put on really a milk run machine of just going around round the roundabout for no actual purpose, other than to aggrandize the doctors within their own community of pretending how big time they are, the amount of people they're referring, the income they're generating for their buddies. So that over-servicing is clearly an issue, and a huge issue at that. Also, the requirement to keep on going back to the doctor to get nothing, and thereby incurring another fee, and that sort of, and again, apart from the time of driving there, that drove me insane. So those, I think, over-servicing is where the big rort is, but that sort of pales into insignificance beside the fraudulent rorts that go on that are directly tied to mass migration. I mean, you can always plot as the mass migration chart or graph goes up from the amount of people in Australia that are not born here, and then you plot the same chart that's alleged for the fraud in Medicare and in the pharmaceutical benefits. I mean, the two lines almost match exactly as in my view, and yet that's something that's never discussed. You never see it in the media, and it is widespread. I mean, there are quite a few now that are starting medical practices that are starting to demand that you must show your ID. Now, this is, this sort of unfairly targets white people because white people aren't the ones that are doing the fraud. So it's, but the argument that they're making in the medical benefits, the argument they're making in these medical centres is, oh well, if we have to do it to the Chinese, the brown and the black people, then we have to do it to the white people as well for equity. But the white people aren't the ones that are. The reality is that it's all these third world people. Not only that. I mean, there are other things going on, like say someone in China has certain health symptoms or conditions, but they can't get it service in China, so or the service they get's next to useless. So they'll contact their relative in Australia and say, look, I've got a headache and I've got this and I've got that, describe the symptoms. Then the relative in Australia then rents a medical benefits card from some Chinese guy that's doing it as like a racket, and go into the doctor and say, I've got the following symptoms. Can you? What do I need to do? And it must come across as strange to the doctor. So, well, you haven't got those symptoms. Why do you say? But they do that. So the doctor will then say, well, if you've got those symptoms, you need to take the following medication, for example. So then they'll go and scan the medication in Australia and send it to their relative in China. So a lot of the people here in Australia are actually acting as proxies, if you like, for their relatives in India or China or any other third world country. So those scams are going on also. So now, in order to tidy it up, they'd have to have a concerted effort on and deal with all the immigrant rackets. A lot of black and brown people would end up being convicted of fraud and rackets and scams, and the government, particularly the government we have at the moment, would be very reluctant to do that. So they'll try and find a way of limiting it, but without appearing to be clamping down on the fraud, which is overwhelmingly committed by these third world people. So when we're looking at Medicare, but this could be a synonym, I guess, for what's happening all over the Western world at the moment. Masses of black and brown third world peasants all trying to scam the medical care system and bring out their sick, handicapped relatives to get the free medical care and so on. And it's placing a crushing burden on the Western medical system. But what it means is the white people, the indigenous people, the people here originally, who never agreed to this mass migration, are the ones that are suffering. When they come from a third world country that's got no fucking medical care system, whatever they get here is a bonus. But we used to have quite an efficient functioning medical care system in the West, and that's sort of disappearing fast. And again, it's the white people who are suffering a reduction in services, a reduction in standard of living, and watching their society spiral down the sinkhole. You've been with Tacitus today, your Pushback channel. Thank you for listening.